My name is Nell Meosky Luo. I'm the founder and CEO of Folia Health. We are a Boston-based health technology company focused on what we call home-reported outcomes. We've been collecting this data for the last 9 years in complex chronic conditions ranging from the more common, like cystic fibrosis, sickle cell disease, lupus, to more rare. Recently actually started a program in CIDP, PNH, and IgAN, so we're kind of across the gamut. The way that we focus on therapeutic development and the evidence that you need to actually be impactful in your therapies that you're working on is we think about what Alicia is referring to as, actions data, right? What is the data that actually makes a difference for an individual patient or a family caregiver who is trying to make sure that they're actually going to feel better right after they take your therapy? This is ultimately what's most meaningful to patients. It's when we think about patient priorities, it's the number one priority that people have, right? Is can I feel better? Can I actually live an unencumbered life that's not nearly as affected by my condition as it might have been before I encountered this therapy? So when we think about what we are measuring right now in many of our trials, we are trying to get at this concept of whether people are feeling better, but we're often not collecting data that is directly answering that question, right? We're collecting surrogate outcomes or correlatives that are, directionally accurate. They have an impact on how we understand someone's disease state, but they're not always exactly the thing that we're trying to move, right? So as an example, lupus, obviously, hopefully we will have some really highly effective therapies available for lupus in the coming years. It's a hot area of development, certainly an extreme level of burden for people with lupus or lupus-like B-cell conditions. What matters for someone with lupus, right? If you talk to them, what matters is their flare experience. How often are they experiencing flares? How debilitating are those flares? And are any of the remedies that they have available to them at home at all helpful, right, to resolve those symptoms? Medication side effects are also a huge part of the experience in many autoimmune diseases, right? And it's this titration experience. My brother has an immune deficiency that also has autoimmune complications associated with it, and it's the monthly question with his care team is whether or not it makes sense to continue his current immune modulator because the pluses and minuses are pretty. It's a pretty carefully balanced benefit risk equation. So that's a simple example. I'll skip down to sickle cell disease, which I know a lot of people have some familiarity with. Obviously, everyone wants to understand pain flares differently from VOCs. These are two distinct phenomena, which a lot of people who are living with the disease and their clinicians know instinctively, but they haven't been able to previously show that that those are two different things that matter equally but differently. And if you're able as a sponsor to measure these types of things, and then you say my therapy has an impact on chronic pain flares and also has some impact on VOCs or vice versa, now you're talking the language of the patients that are looking for your therapy and the clinicians who are looking for something to prescribe that will actually have a direct impact. So this is something that I think a lot of people agree with in theory, but feel is, maybe impossible to achieve. It's not impossible. Like, if you take anything away from my few minutes here, it is extremely possible to measure this type of information directly from patients at home. It is actually less expensive to measure these types of outcomes than most other outcomes that you are focused on. The reason that we know this is that we've been doing this, as I said, for the last 9 years. We've been actively collecting data in observational studies for 8 of those years. We've run national studies, and in every condition that we've worked in, we now have work published, I think 6, and we have 10 that are active. We have found that people are very willing to collect high quality, granular, longitudinal data. Why? It gets back to Alicia's point about making sure that the data is meaningful, right? And that it's actually something that's worth their time. I think that this stinginess concept that she brought up has to do with people feeling that they're being asked to collect data that's not actually useful. So they're giving you a lot and they're not sure what they're getting back. If you give someone the ability to collect information that is truly useful to them, it's no longer a chore, it's actually beneficial, right? So this is the fundamental principle behind how we collect data, which is that people naturally do want to journal. They do want to collect information on what they're experiencing. They just need a structured format to collect that data in a way that's actually usable for themselves and for other people. So instead of journaling, if you can collect it in a series of questions that are multiple choice or multi-select, you can really make that action data. I'm just going to keep borrowing Alicia's words. The example I'll give in sickle cell disease, this was a study that we ran with Global Blood Therapeutics and then Pfizer. 24, almost 25 flare days were captured per participant in this study, right, over the course of only 3 months. And people were collecting this data in real time. So we asked when people reported a flare, is it happening right now? And 88% of those responses were, yes, it's happening right now. I'm collecting the data as I'm experiencing the flare, right? So it's possible to collect information like that. And what's interesting is that the volume of data is also quite high when you ask people to track what they're experiencing. We saw nearly 50,000 individual button clicks in this small study, 66 people over 3 months, which is more than 200 of these responses per participant per month. And then we got some great feedback. People weren't like, oh, that was a lot of work. It was, that was a great study. I'm actually extremely interested in collecting this data for myself, and the sites, the clinicians that were part of this also found it beneficial. We actually heard from our sponsor that we gained them some sites that were more interested in this type of research than the traditional, more burdensome experience. So what I would just like to leave you with is that it's very possible to collect information that's directly relevant to patients at scale with a granularity that is usable, right? Like you can actually analyze it and get a lot of observations. And the reason is because the individual participants find it meaningful and useful. So I think that it's not more work to be relevant. It can actually be less, is the argument that we're making. Thank you.